Defining the competition for my wellness plan is fairly easily identified. The total market is limited to the number of employees and dependents covered under our health plan and are contained within a defined geographic area. There are roughly 4,000 covered lives to our self-insured plan. In many ways, my business plan does not compete in the open market. This does not, however, indicate that there aren't competitive forces that exist. For our on-site clinic, the cost savings or revenue is through diversion of customer access to the ER and urgent care clinics. These clinics, along with our own ER, are the competition for this portion of my business plan. For CDTM services, no traditional competitor exists. It could be argued, however, that the customer himself is the competition. For CDTM, we are competing against the customer's competing life priorities in general. Lastly, generic utilization. The competitor is the pharmaceutical corporations that market brand medications to prescribers for our customers' medications. These drug reps market their products in an attempt to persuade prescribers' decisions for medication selection. Traditional market share distribution analysis is not available for my project. We do know, however, that ER utilization is 208% compared to benchmarks. I have not been able to get separate data for utilization of urgent care competitors. Our costs for diabetic patients are also above benchmarks, and we also know that our generic utilization rate is 74% compared to a target rate of 88%. These benchmarks and targets do not necessarily equate with market share, but will be used in similar ways for creating business strategies. For our on-site wellness clinic, we offer several advantages over the competition. The primary advantages are price and convenience. The service will decrease average wait times and treatment times for customers by about 50% compared to urgent care clinics and about 85% compared to ER services. Our clinic will be free to the customer compared to about $200 for urgent care and $400 for ER. We will also exceed in quality of care due to our ability to provide continuity of care by having patient records available and our ability to communicate with the patient's other providers through the electronic medical record. We will not compete in terms of convenience for hours in service. The ER is open 24 hours a day, 7 days a week, and urgent care clinics are also open in the evenings and weekends. True urgent emergent care will still need to access these competitor services. We choose not to enter this competition. CDTM services are competing against customers' other life priorities. Convenience and value are the competitive advantages that exist for this service. By offering these appointments on-site and free of charge, the customer will be more likely to choose access to this service as a life priority. The advantage that we create for generic utilization is through cost incentives to the customer. Our average copay for generic medications will be less than $10 and potentially will be free. Brand medications will require a premium, likely in the form of tiered pricing. Brand medications that have no generic alternative will continue to be deeply discounted at around $25 per prescription. However, if these brand medications have generic alternatives, we will have copays of $50 or more. These incentives, or lack thereof, provide the competitive advantage for generic medication choices over brand. We will remove access for pharmaceutical reps to the provider clinics that we own. We will replace this biased medication information previously given by drug reps with quote-unquote academic detailing, where a pharmacist provides unbiased information that will lead to a reduction in brand medication prescribing. Academic detailing will also be offered to other clinics that provide a high volume of care to our customers. Long-term organizational leadership support is necessary. Competition for funding of the program currently exists and will become even more difficult in years to come. Our senior leaders and board of directors must have a clear understanding of the value that wellness services provide and have an understanding that long-term commitment is needed. Another potential barrier that exists is the presence of unions within our organization. Union contract negotiations can be challenging. Although it is obvious that these services are beneficial to the members of the unions, conventional logic does not always play out in these negotiations.